A new study has found that despite spending more on health care than most other developed countries with the universal coverage, Canada has a relatively short supply of doctors and hospital beds and the longest wait times. Joining me to discuss this is Bacchus Barua. He is the Associate Director, Health Policy Studies with the Fraser Institute and one of the co-authors of the study comparing performance of universal health care countries 2019. Good to have you with us again, Bacchus. Can you give us a snapshot of how you went about with this study comparing Canada with 28 other universal healthcare systems in high-income countries?
Well, Paul, healthcare is incredibly important for Canadians, and therefore it's also important for us to consistently gauge how well that system is actually performing. One of the ways that we can do it is by using a value for money approach, which is, as an economist, that's what we tend to do. And essentially, it's trying to figure out how much money we're putting into the system and what we're actually getting out of it. So as you said, we looked at 28 countries around the world with universal healthcare. So there's not a question of universal healthcare or not. We looked at 48 indicators, on the one hand, on looking at spending, and on the other hand, in terms of results, trying to look at things like the availability of resources, the utilization of resources, timely access to care, and the quality of those services that are delivered.
Okay, so where did Canada rank when it comes to how much we're spending on health care compared to the other countries?
Well, in terms of spending, we're actually right at the top. When we look at spending as a percentage of GDP, we rank second highest after adjusting for age, and we also rank 10th highest on a per capita basis, which is, looks better than the GDP figure, but still well above the average for the OECD countries amongst the 28 that we're looking at. So one thing's clear that, if we do have issues with our healthcare system, it's certainly not a result of spending.
Okay, that's important to note. Something needs to switch here somewhere. How did Canada do with the availability of resources category? Do we have enough medical professionals? Do we have enough medical equipment like acute care beds or MRIs, that sort of thing?
Well, unfortunately, we're really not seeing the spending translate into the availability of resources. Just for example, in terms of physicians per capita, we're right at the bottom of the pack, ranking 26th out of 28 for the ratio of physicians per capita. We do a little bit better in terms of MRIs and CT scanners, ranking about 21st. But then again, when we look at acute care beds, we're back at the bottom at about 26 out of 27. And the thing is, these figures really help us understand why we have the issues that we routinely see in the newspapers. Issues like, individuals not being able to get a doctor, issues like individuals having to wait for a hospital bed. Well, it's no wonder we actually have some of the fewest doctors in the world, and we have some of the lowest ratio of hospital beds in the world as well.
So I guess the question is why, right? I mean, if we're spending that much money, why are we short on physicians and in some cases certain types of equipment? I mean, what are other countries doing differently than we are, to get better results?
Well, there are a lot of different areas that we can look at performance. We're doing poorly in terms of access, and we do remarkably poorly in terms of timeliness of care, and we kind of do across the spectrum in terms of utilization and quality. But overall, absolutely, there are a number of other countries with universal healthcare that outperform us on a number of these metrics. And the key difference is that they do universal healthcare differently. Some of the things that they do is they partner and embrace the private sector as either a partner to deliver the universal healthcare promise or as an alternative. They generally expect patients to share in the cost of treatment to sort of temper demand, of course, without ever trying to make sure that it's never a financial burden. So you have exemptions for vulnerable populations. And they fund their hospitals differently. They fund the hospitals based on activity, trying to incentivize them to actually treat patients. Whereas in Canada, because of the monopolistic structure that we have, we're still funding hospitals based on global budgets, which makes hospitals really think of patients as a cost that are eating into this budget. Now, of course, it's not like any one of these things will magically fix our healthcare system, but it is important to remember that when we look at countries that outperform us on these indicators, they do universal healthcare very differently.
Okay, yeah, it's not that they don't have universal health care, they just, like you say, do it differently. I think we have this innate fear here somehow that we're going to end up like the US as soon as we mention the word private/public. And I think somehow we maybe have to get over that. And I think there is maybe a move underfoot here in Canada that's beginning to change some minds, and we continue to come back to this when we look at, wow, how much we're spending and how little bang we're getting for the buck. And, we see these line items in every provincial budget going up and up, closer to 50% of the budget going toward healthcare, and still long lineups. So hopefully some of that will begin to change when we look at countries, on this list, if it's a Sweden or a Switzerland, Great Britain, a UK. We see these are not countries that leave patients behind. They're not, they're actually fairly socialistic countries, and they're having a better bang for the buck. So hopefully something begins to change. Now, you have a category labeled use of resources. So for the resources that we do have, how well and how frequently are we making use of these?
Well, the answer to that is a little bit of a mixed bag. On the one hand, it does seem that we're trying to use some of our resources, some of our limited resources to the best of our ability. So we do have a higher rate of utilization for things like consultations with the general practitioner. But on the other hand, we do very, very poorly in terms of things like the amount of hospital activity. We're, again, ranking close to the bottom of the pack over there. And we're somewhere in the middle when it comes to MRIs and CT scans per scanner. So we're trying to reuse the resources as best as we can, but obviously we're sort of facing a little bit of a bottleneck where a lot of people are trying to access their family doctors, trying to get into the hospitals to get treated, but obviously what we're seeing from the data is the number of services actually provided is not matching up, and it's no wonder therefore that we see the long wait times that we routinely do in Canada. So a bit of a mixed bag in terms of utilization.
Yeah. Any thoughts on how that could get fixed short term, or is that again more of a long term, gradual kind of a change?
Well, it's always good to try and use your resources as efficiently as possible, but that only goes to a certain limit. At some point, you have to contend with the fact that we do have the lowest ratios of physicians per capita. One of the lowest ratios of physicians per capita, and again, we're right at the bottom of the pack when it comes to hospital beds per capita. So, we can try as best as we can to use these resources efficiently, but at some point of time, we actually have to think about whether these resources are actually sufficient for Canadians.
Do you know off the top of your head? I know the study didn't focus on that, but we do hear sometimes of a brain drain going south of the border. Is that part of it? Again, our physicians here, they are business people. They do charge the various provincial governments for the services. It's not free in that sense, right? But there's a cap, I think, that we kind of place on that, on those services as compared to other countries like the U.S. Is that where we're losing physicians towards, or?
We haven't looked at it in this particular study, but there is a study I did a couple of years ago that was looking at the physician supply, and we were able to tease out a little bit of what this brain drain was. And it is there, but it is a small portion of our problem. The main problem that we have is that in the early 1990s there were government controls that came in on the number of physicians who are actually trained in Canada, the number of residencies that are there in Canada, and our reliance on foreign trained doctors. The result was essentially a plateauing of our ratio of physicians per capita, whereas the rest of the world continued to develop as they understood that physicians are a vital and important part of our healthcare system. The result is a situation where right now, even though we're training physicians, sometimes the physicians who are graduating aren't able to actually get a job within Canada. So, it's a complex system of policies that are really resulting in the fact that, on the one hand, not enough physicians are being trained, but even if they are trained and even if they do graduate, sometimes they have difficulty actually getting a job in Canada. But that's not what we looked at in this particular study.
Yeah, I'd be interested to see what happens with that down the road. Something needs to change there, of course. We have a need for them, so we should be able to get them some jobs, right? Now, Canada didn't score particularly well in the category of access to resources. Can you explain what that means and why we're having trouble getting access to healthcare resources that we need in a timely manner?
Well, I think one of the key ways that the Canadians are concerned about their healthcare system is the timeliness of care. I don't think I need to. It comes as a surprise to anyone that we have some of the longest wait times in the developed world. But the fact of the matter is that it's not a necessary consequence of having a universal healthcare system. Some of the indicators that we look at in this particular study is looking at other countries with universal healthcare, and Canada is routinely right at the bottom of the pack when it comes to timeliness of care. For example, when it comes to the percentage of patients who had to wait 2 weeks or longer to see a specialist, Canada's right at the bottom. Another indicator that's looking at the percentage of patients who waited 4 months or more for treatment, again, right at the bottom. And just to give you a little bit of context about these numbers, the percentage of patients who were waiting longer than 4 months to see a specialist was 18% in Canada. By contrast, in Germany, that percentage was zero. There were no patients who reported waiting as long. And even if we look at other countries and other systems, looking at countries like the Netherlands and Switzerland, the numbers over there are maybe 7 to 8% who had to wait as long. Nothing like the sort of wait times that we see in Canada. So it's not a necessary consequence of having universal healthcare, but it is certainly a consequence of the way that we do universal healthcare.
Hmm. And I understand that cost was also one of the reasons, of several reasons for hindering patients from getting care in a timely manner. Any examples of that you could share with us?
Well, cost is a little bit more complex. And, over here, we're trying to measure whether cost was a barrier in terms of access to care. Again, that's another way of thinking about access. And I think a lot of Canadians would be surprised that even in Canada, we're sort of in the middle of the pack, despite the fact that we have a well-lauded universal healthcare system. Now, I would say some of the primary reasons why we're not performing at the top of that has to do with the cost that sometimes patients incur when they need to access pharmaceuticals or when they need to access dental or vision care. But we're also not at the top when it comes to things like accessing a medical doctor. Again, when we look at countries like Germany and Sweden and the Netherlands, they actually routinely outperform Canada on all those indicators. They also cover pharmacare, but they also embrace the private sector. So, I think all of these other countries have a better understanding of trying to use the best tools at your disposal and putting in the regulations you need to ensure that patients are protected. It's only in Canada where we think that government is the only answer, and we're sort of paying the price for that.
Yeah, so our mindset somehow has to change to say, hey, let's do something similar here. If it's working over there, good chance it's going to do something good here too. What about the category of quality and clinical performance? Can you tell us a bit more about that? What's included in this category, and how did we do?
Sure, quality is obviously a vital part of trying to assess how well our healthcare system is doing. But it's also really important for us to make sure that we're not conflating this with general health. Although that's the ultimate goal of any healthcare system, general indicators of health status like life expectancy can be affected by a variety of factors, including things like genetics, including things like pollution, activity, etc., which are really outside the purview of the healthcare system. So when we're looking at quality and clinical performance, we want to talk about how well is the healthcare system actually doing at improving the health of patients. So some of the indicators that we look at are showing that we're actually doing quite well. So when we look at, for example, survival of breast cancer, we're ranked sixth, very, very well. Not top, but better than most of the other countries. We're sort of in the middle of the pack when it comes to stroke survival rates, but then we're at the bottom of the pack when it comes to things like obstetric trauma. We have some of the highest rates of obstetric trauma amongst the countries that we can compare ourselves with. So again, a little bit of a mixed bag, a couple of bright spots, and essentially it's sort of telling us that our healthcare system is good when somebody has a crisis. But unfortunately, everybody else is sort of left to fend for themselves or try and find healthcare outside of our borders.
Hmm. Okay. Well, I guess the question is, what can we do to improve our healthcare performance? What can we learn from these other nations who are doing better? And you touched on it earlier, but refresh us here again. Are some of these countries allowing for some, private financing for medically necessary services, that sort of thing?
The private sector is clearly one of the key ingredients in better performance, but it's not the only difference. Routinely, when we look at countries that are outperforming us, and these are countries including Switzerland, the Netherlands, Germany, France, Australia, again, all countries with universal healthcare, they do three things differently. They have a different attitude towards the private sector. They either embrace them as a partner to deliver universal healthcare, or they use it as a pressure valve to say, okay, well, when the public healthcare system is not attending to patients, you have an alternative. They expect patients to share in the cost of treatment. This is not to say that patients have to completely fend for themselves, but these are generally things like having a small deductible, asking patients to pay 10% of the cost of their treatment, and of course with an annual limit to make sure that it's never a financial burden, and with exemptions for certain populations, pregnant mothers, for example, diabetics, to ensure that they're not overly burdened by these co-payments. And they fund their hospitals differently. They incentivize the hospital to actually treat patients, so that every time a patient goes into the hospital actually gets funding, which again is related to the fact that they have extra capacity because they're private insurers. Ultimately, the key difference I find is that these countries put patients at the center. In Canada, we have a system where essentially we have to adapt to our healthcare system, whereas these other countries say, okay, well, we're really interested in ensuring that patients get timely access to quality care regardless of ability to pay, and let's use the best tools at our disposal to actually get that. And that's the key difference with these other countries that outperform us.
Wow. Thank you for sharing that. Those are three key issues, again, that maybe we need to adjust our Canadian mindset to say, hey, let's maybe give that a shot. I mean, because again, as you point out in the study, we're not getting a real good bang for our buck. And so we need to change some things in our system. And again, in our current political climate, realistically speaking, we have a minority government in place. The odds of seeing any significant changes real soon, probably not super high. But you think maybe over the next few years we could see some changes?
I'm definitely not a political pundit, but I can say that, studying this subject for the last 10 years, it seems like regardless of which government's in power, the general attitude seems to be to pump more money into the system. If we actually look at the data, we can clearly see that money is not the problem. We're actually spending quite a lot on our healthcare system. Unfortunately, I don't really see anyone with the real courage to actually attend to the policy reform that would enable us to use the policies that are pursued in countries that are more successful than we are. Until that happens, I don't really see change on the horizon. But there is one silver lining, and that's, I think, Canadians actually getting a better understanding of what's out there, and actually, if something does happen, it'll come from the ground up. And I think I'm optimistic about Canadians actually understanding how this can actually be done better in the future.
Really appreciate you taking the time for us here today, Bacchus.
My pleasure. Thank you so much for having me on the show.